Hi, I'm Dr. Hilary Lampers, naturopathic physician and neurocranial restructuring specialist. Today I wanted to talk about how NCR, or neurocranial restructuring, can benefit newborns and children. When we think of newborns, we tend to think of perfection. For any of you who have been at the birth of a child and experienced that, or even been through it yourself, you know that it's one of the most miraculous things in the world. The truth is, though, is that birth is very traumatic. By nature, the mother and the baby both have to go through a series of very transformational processes to get a baby out. If we think about the baby and what it has to do in order to descend and to be born, this is really important for thinking about cranial function as well as neurological function. And so this is why I love to work with children, because they have so many varied ways in which NCR can help them. Think of a birth, if you've ever been to one, or if you've ever had a child. When a child is coming down the birth canal, their sutures cross. This is a natural way so that the baby can get the head through the birth canal and out. Okay, so these sutures naturally cross a little bit, and again, babies' heads are very soft, so the bones are very soft, and the sutures cross. And as they go through the last stages of labor and they descend through the pelvic bone, and then you have crowning, as we know about it, so the baby will start crowning and then the baby's born. This process is actually supposed to happen not super fast and not super slow. It's actually meant to happen at a somewhat paced rate so that the sutures can cross slowly, the head can descend and crown, and then before the baby's born, the head itself the suture should start to uncross. Once the baby's born and they take their first breath of air, this begins the initiation of pumping cerebral spinal fluid around their brain and up and down their spinal cord, and also starts to move the head. The sphenoid bone is a really important bone because what it does is it stimulates that movement of the cerebral spinal fluid, and it helps determine head shape. So if you've ever seen a baby after they're born, they look kind of freaky and alienish. And then in a couple days, wow, they start to have this nice round head. You may notice some children don't ever get rid of their cone head, or perhaps they develop flat spots on different parts of their head. And these are different conditions. It's a group of conditions we would call plagiocephaly, which can be malformation of the cranial bones. And conventional treatment for plagiocephaly is helmets, a medical helmet. So the helmet is meant to get the bones to kind of go back to that more symmetrical place, and it helps with brain development. The problem with the helmets is they're really uncomfortable, and children have to wear them for about 23 hours a day when they're very young, and so it's difficult for bonding, breastfeeding, etc. If you think about those cranial head shapes and wearing the helmet, NCR does the exact same thing. It just does it from the inside out by manipulating that sphenoid bone that's somewhat stuck and not doing its job of allowing the cranial bones to move efficiently and grow. So we can do a treatment, usually in a baby, just a couple treatments, and you can see head shape change very quick. I have patients come to me mainly because either the child was in the birth canal too long and they sat in there and their cranial molding, basically their sutures got completely stuck because they were there too long. Or you see these children that were born super fast. So the mother went into labor 2 hours later, the baby was born, and the sutures didn't have time to uncross. So the baby just came out and the sutures really hadn't had time to do that. So these are great conditions for considering getting NCR for your baby.